Hi, my name is Simran and this is my video for my dressing wound change. First of all, I'll begin off with a 360 of the room. Hello, Mrs. Smith. My name is Simran. I'm going to be your nurse for today. I'm here to do your abdominal dressing change. Do I have your consent? Okay, great. I'm going to provide you some privacy. First of all, I'll begin off with my hand hygiene. So can you tell me what your first and last name is? Al Smith. Okay, I'm going to take a look at your ID tag. Al Smith. Okay, great. And my bed is at waist level. So I'm going to take this blue pad right here. It's going to open it up and fold it and tuck this underneath you. Just like that. I'm going to tilt you over a bit so that when I do irrigate the wound, the saline will fall directly onto this blue pad. So I'm going to open up my sterile tray and just place it right here. So now I'm going to tape my garbage bag onto the side of my bed rail. And my garbage bag is at waist level. And it's between where I'll be irrigating the wound and my sterile field, so it will be easy for me to throw the garbage. So once that is done, I'm going to put on a clean pair of gloves. And I'm going to be removing the old dressing. Let's take a look at this. So on the outside, there does seem to be a bit of red dried blood. It's dark red. This may hurt a bit, Ms. Smith. Just remove the tape on the sides. And let's check underneath. There isn't that much of red blood underneath the gauze. And let's take a look at the ribbon. There is quite a bit of red blood on the ribbon gauze. Don't worry, we'll get that changed for you, Mrs. Smith. So now I'm going to do my hand hygiene again. And we're going to open up our sterile field. So I'm going to open the first flap away from myself and then to the sides. And here we can see we have our transfer forceps. I'm going to use my transfer forceps just to square off my sterile field. And as we know, the first inch around the sterile field is considered contaminated. And I'm just going to square off my tray. And in our tray, we have our transfer forceps. So from the nubbies and forward, is considered sterile, and where my hands are is considered contaminated. So in our tray, we have an extra drape. We have 2 sterile forceps. We have a couple of 2x2s for cleaning the wound. We have a couple of 4x4s for drying the wound. And I'm going to be adding a couple of things to my sterile field. So I'm going to add my AVD pad. Just going to drop it like that onto my field. Or you can pull it out. Like that. I'm going to add a couple of 4x4s. We don't want it to be too high, otherwise things can bounce off our sterile field. I'm going to add my syringe. My blunt-ended needle. My cotton-tipped wound applicator. And I'm going to open up my sterile scissor from my suture removal kit. So the handles are contaminated. And I'm going to place it within the 1 inch on the outside of the sterile field. I'm going to add my ribbon gauze. I'm just going to cut how much I need for the wound. I'm just gonna cut that with my scissors. And I'm going to add my saline. So I'm going to open my saline and just lip some into the garbage. And then pour some into this portion right here so that the ribbon gauze can get wet. So now that's done, I'm going to open up my sterile gloves. So the outside is considered contaminated, and once again there is a 1 inch for the sterile field. So the 1 inch is contaminated. We're going to pick it up from the flaps here. And I'm going to put on my right glove. I'm going to hold it from the cuff, tuck my thumb under, and put it in just like that. Now I'm going to take my right hand and I'm going to put my hand under the glove just like that, and I'm going to tuck my left thumb in and keep my right thumb back so it does not touch my skin, and put it on just like that. So now that we have our sterile gloves on, I'm going to attach the blunt ended needle to the syringe just like that. And now we're going to begin by irrigating the wound. So I'm going to withdraw some saline into the syringe. I'm just going to fill the syringe up. And I'm going to irrigate the wound. This may feel a bit cold, Mrs. Smith. So as I'm irrigating the wound, there is a bit of fluid. And it is washing off to the side, which is great because you are laying on your side. Okay, that looks good. So as we're done irrigating the wound, I'm going to dispose my syringe into my sharps container. So once that is into the garbage, I'm going to clean the edges of the wound. So I'm going to take my sterile forceps, and I'm going to take my 2x2 and just saturate it into the saline, just like that. And I'm going to hold it and just wring it out. So once we've wringed out the 2x2, I'm going to keep my forceps down. As we know, fluid falls in the direction of gravity. And I'm going to wipe one way and down and into the garbage. And our forceps are still sterile since we did not touch the wound. So now I'm going to take another 2x2 and repeat again. So I'm going to saturate it into the saline, and then I'm going to wring it out. I'm going to wring it out just like that. And then I'm going to wipe one way down and then into the garbage. Now I'm going to take a 4x4 and just place it onto my sterile field right here, and just bring in all the corners. And I'm going to dry my wound. So one wipe down and into the garbage, and once again for the other side, bring in the corners, one wipe down and into the garbage. So now that the wound is dry, we're going to take a couple of measurements. So I have my wooden my cotton applicator right here. So we're gonna check the length, width, and depth. So we're gonna estimate just like that. Make sure we're not touching the wound. I'm gonna measure here off onto the side. So this is about 4 inches in length. And now for the width, it's estimated. Make sure we don't touch the wound. It's about 3 inches. And now for the depth, make sure we do not touch the wound. And now again, it's about 1.5 inches in depth. So now that we are done measuring the wound, I'm going to apply the ribbon gauze. So I can take my ribbon gauze and wring it out. Just like this. Or I can wring it out with my hand, which is easier because I have more control. So you can wring it out like this. And I'm going to apply this into the wound bed. Once again, keeping my forceps down as fluid flows in the direction of gravity. And I'm just going to put it here into the wound bed. I'm gonna tuck it. Make sure it's not packed too tightly, but just enough so that that it's not too tight. Just like that. Are you doing okay there, Mrs. Smith? You're doing a good job. And I'm gonna make sure it's to the top and just pack it down lightly, just like that, because we don't want to suffocate the wound bed. So now that it's done, we're going to redress the wound with a 4x4. Just like that. And we're going to add a ABD pad over the wound dressing, just like that. So I'm going to take my gloves off. And dispose that into the garbage. I'm going to take my tape and tape up the wound. Are you doing okay there, Mrs. Smith? You did a really good job. This is nice and tight. So now that the wound is covered, I would take my equipment and clean up my station and do my hand hygiene, and that is it for today's video. Thank you.